So could you explain to us what is a gene test and what is a genetic disease?
Okay, so I would start by what is a genetic disease. So a genetic disease is a disease that has been triggered because the genetic code is modified as what we call a mutation. And then the mutation will impact on what the gene is making, like a protein. And regarding inherited retinal disease, genes that are mutated are encoding proteins that are really important for some aspect of the vision mechanism. So we are always puzzled with inherited retinal disease because it's not just only one gene that can be mutated and lead to that, but there's a lot of different genes, and so far there's at least 300 genes that, when mutated, can give rise to several types of inherited retinal disease, from some that are congenital and stationary, that will be still impairing a patient's daily life, but not progressing toward degeneration. But some others may start at either an early age and progress, or a later age and progress. Some of these disorders are only involving the eye, the retina in my part. This is my
your expertise,
part of interest. Yeah. Yes. Or some others actually, and that's even trickier, are not only involving the retina but some other organs, like Usher syndrome, which is the most common, the most common syndromic form of inherited retinal disease, with the ear and the balance also for some subgroup of Usher syndrome. So a lot of clinical heterogeneity in this disorder, and mirrored by a lot of different gene defects that can be implicated, associated with this disorder. So in the old age, when we wanted to find the gene defect, there were either we had large families and we were trying to link chromosomal regions to a specific disorder, and then sequencing got improved, and then so people would sequence a gene precisely, but gene by gene. And then around 2010, genetic testing improved a lot. And now, with the advance of high throughput sequencing or next generation sequencing, and now you have very comprehensive genetic tests that are completely suited to encompass the genetic heterogeneity of inherited retinal disease, which are either looking at panels of genes that are associated with specific inherited retinal disease, or now some people are even moving to what is called whole exome sequencing, where we look at all the coding region, the gene that are expressed in the body, or even the entire genome. And it's also for the genetic, it's an exciting time because now we have very, very precise genetic tools to be able to more closely characterize the exact gene defect that led to the inherited condition.
That's fantastic. And thank you very much for kind of giving that scope for what a genetic disease is. Mm-hmm. So I guess, can you explain what a genetic test is and how important is it in your opinion for people to know about getting it, and then having that knowledge that they can then do something with?
Sure. So a genetic test will start by genetic material. So when a clinician, a geneticist, an ophthalmic geneticist in our case, suspect based on the clinical characteristic of a disease on a patient or a specific family history, will prescribe a genetic test. So the genetic test is usually performed either from a blood test or from saliva. And of course, the patient is informed of the type of test that will be performed. Usually, the patient signs an informed consent. He's also informed why this genetic test can be critical. And that could be, for example, a young couple has a first child that is affected and want to know if there's a risk for the rest of their potential children. Or there's a diagnosis that really need to be confirmed by a genetic test. Or, and this is also something very critical now, there's a rare disease, an orphan disease, for which now we have some potential either therapeutic trial or treatment, and defining the precise gene defect may help this patient to participate to these
trials or
these trials.
The upcoming treatment. And you spoke quite passionately at the start about the new era or a kind of new wave, if you will, that has almost been, as a field, been waiting for. And, you know, you've mentioned since about 2010, really has accelerated. For you, how important is it for someone to personally harness that information so that they can be proactive and get in a trial or kind of know what's happening?
Yeah. So, you know, sometimes as a clinician, you diagnose the new patient, you explain, and so far, except for just one disease, we don't have any treatment to propose. So the patient is anxious because the patient has come with some symptoms. Now you give a name to a disease, but then you have to tell them, you know, you should take care of yourself, protect your eyes from the sun, avoid toxic things, which are quite actually limited. But unfortunately, besides supporting you, give you maybe some rehabilitation courses or things like that, there's no prescription. And now we can explain them that first there's this first gene therapy treatment since in the States 2017 and in Europe 2018. But then there's a lot of other treatment
coming down the line.
With a lot of different clinical trials that are built. And of course, for this to be part of, is the most precise characterization of your disease is critical, because then we can decide whether you're the best candidate to benefit of this research protocol. And part of the most precise characterization is the genetic characterization, because most of these gene therapy trials that are either here or coming soon are based on a specific gene defect, and the sooner they get there.
So really having that information empowers someone to really join, or at least try and get involved with the research itself.
Or at least be able to be called to discuss the trial, decide whether they want to be involved or not.
That's wonderful. So I mean, I guess the last thing I want to cover is how can I or a patient or someone listening to this get a genetic test? I mean, obviously it will vary from country to country, but maybe from your personal experience in France, you know, what are the steps? So
I think it's still critical to have a proper clinical diagnosis, like to see an expert, the ophthalmologist, the ophthalmic geneticist, but to have a precise diagnosis that it's indeed looking like it's a genetic condition. And then to discuss with the person who will prescribe the genetic test, what will be the consequences for the genetic test. And then if the patient is well informed, get the genetic test done. And we really, again, encourage patients to have this genetic done as soon as possible. First, because this modern high throughput technique, the results may take time to get generated because it's a complicated test. And second, again, that may lead to them being involved in research protocols that may be exciting. And that's, I guess that's currently the best way to be proactive in moving forward with their disorder.